Hello, nurses. This is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing in the NCLEX. Today's focus is on NCLEX questions and the process behind them. You can find me on social media, Instagram, Facebook, Pinterest, Etsy, Nursing Kamp, and on nursingkamp.com. Okay, let's go to our first tip. First tip is priority action questions. Best, most, first, priority action. Seeing those words, best, most, first, priority, action. We always assess before we implement. Always. And the reason that is because if I walk into the room and the patient has shortness of breath, I would put them in the high follows position. Okay? Because I assessed they were short of breath, and then I'll implement. So I'm not going to walk into the room and just see the patient, and then I'll put you in the high follows position. I wouldn't do that because nothing told me to move them, and that's assessment. So it's very important to assess before we do anything. Let's take another example. I'm not going to walk into a post-op patient's room, and medicate them with morphine. Well, they're post-op, so they should have pain. No. It's because I assessed they were in pain. Then I would medicate. Implementation. And that's how it works. Assessment before implementation. And as we walk through these questions, I'll be referring to this frequently and showing you when you sometimes have to implement and not do the assessment. And the assessment has to make sense to what the problem is. And we always assess vitals first. And any assessment is required before you would call the doctor. And we generally don't just call the doctor. If there's something we can do here and now, in the room, we do that before we call the doctor. And we always assess before invasive implementations. All right, let's do the first question. First question. A client has had an application of a right long arm cast. He complains of pain at the wrist. Oops, sorry about that. Come on. Pains at the wrist and when the arm is passively moved. Uh-oh. What should the nurse do first? Okay. Best, most, first, priority, action. First. Priority question. Okay. So what should I do first? Well, nursing process states assessment before implementation. So let's go. All right, so we are going to elevate the arm. That's an implementation. Document findings. Well, this is a priority question. In priority questions, we generally just don't do nothing. And the reason we don't do nothing, okay, here's the issue. Patient has an application of a long arm cast. He's complaining of pain at the wrist whenever it's moved passively. That makes it acute. So NCLEX is not going to give me a problem and say, hey, document, do nothing. So we get rid of that. Next one, medicate with an additional dose. What do you mean additional dose? 5, 10, 15, 20? What are you talking? How much of an opioid? Well, which one? Morphine? Percocets? Vicodin? The list goes on. Not really too specific, very vague. And generally in NCLEX questions, it's not going to say, hey, here's a problem. Patient's in pain. Medicate with morphine or an opioid. They know you know how to medicate patients, and we generally will assess before that happens. Okay, so implementation, do nothing. Implementation, and the last one, assessment. Okay, well, nursing process states that we assess before we implement. So let's look at it. Check for paresthesia, paralysis of the right arm. Huh. That's interesting. Is a patient in acute distress? That's the first question. Well, they complain of pain with the arm moving. Okay. Well, they need assessment. I need to figure out what's going on with this arm. So assessment is a priority action, and it's the first step of the nursing process. And that makes it the credited answer. Okay, nurses, next question. A nurse is caring for a hospitalized client, thank you, that's important, with a diagnosis. Okay, diagnosis. Diagnosis means assessment has already happened. And of congested heart failure, CHF. All right, which kind? Right or left-sided? I'm not sure. Okay, so that's the first thing we need to figure out. All right, who suddenly complains of shortness of breath. Uh-oh, this is acute. It's acute because it's short of breath. Okay, so I walk into the room, patient CHF, suddenly complains. Suddenly is acute. Complains. Okay, still alert, so he knows what's going on. Short of breath. And in case I missed that, dyspnea too. So I have short of breath and dyspnea. That's acute. All right, so let's keep on going. The nurse takes which immediate action? Okay, what am I going to do? All right, I can call the doctor. Okay, well, is there anything I could do in the room first? Okay, so I'm going to keep it. I'm going to go to the next one. I'm going to give oxygen. Okay, well, that doesn't sound bad. So it's an implementation. Okay, next one. Elevate the client's head of the bed. Implementation. Prepare to administer Lasix. Okay, implementation. All right, so I have 3 implementations. So I can't assess because I have assessment. I have shortness of breath and dyspnea. All right, so I have to implement. Okay, so let's see what happens after I do each one of these implementations. So let's go. All right, administer oxygen to the patient. Okay, all right, so O2, increase O2. What was his SATs before? I don't know. I don't have it. So would I give oxygen without a saturation? Well, Kevin, he's got CHF and he's short of breath. Yeah, but I have no saturations. And what kind of oxygen? Okay, it's a nasal cannula, is it an arm rebreather? There's some questions with that, but I'm going to keep it. Next one. Elevate the client's head of the bed. Okay. High Fowlers. All right. That makes sense, right? Because I see they're short of breath and they have dyspnea. So elevate the head of the bed. Okay. That's doing something. Patient will get better because CHF patients would like to be upright. Okay, that makes sense. So there's definitely a positive to that one. But like this, we never ever answer all of them. We go to every single answer. Prepare. Okay, I'm going to do something. Good. Lasix. Okay, is that going to treat the problem now or later? Later. Is it PO or IV? Not sure. It's kind of vague. Okay, so, and generally, NCLEX is never going to ask you to give medications when I could do something in the room. And that would make me pick this one because this intervention is the right intervention. I walk into the room, shortness of breath, and I raise them high Fowlers. Credited answer is number 3, elevate the head of the bed. Okay, nurses, my name is Camp, and this is Nursing Camp, and this is my NCLEX tips. You can find me on Instagram, Facebook, Pinterest as Nursing Camp, and also on Etsy and nursingkamp.com. Well, that's it for me right now. We'll go see you in the next set of question set number 5. Nurse on.